Hi, I'm NurseBob. I'm a practicing nurse in Northern California. So today I want to talk about diabetes type 1, which is a continuation of my discussion on diabetes that started a little while ago. So let's get started. Type 1 diabetes was originally called juvenile diabetes because it's seen most frequently with adolescents and young people when it first appears. The official name is diabetes mellitus, and that's what it would be referred to in the medical literature. And of all those that have diabetes, only 5% are type 1 diabetics. Type 1 diabetics are characterized by the fact that they really don't produce insulin. For some reason, the insulin-producing cells have been destroyed, and the causes are actually still somewhat unclear. There's a hereditary factor. It actually requires both parents to have had the trait that allows for them the risk factors for diabetes type 1. And other factors include diet and climate. In particular, people that live in northern cold climates are more prone to diabetes type 1. And there's also a disease component, perhaps. There's a belief or a research that indicates that a virus may be involved in killing off these insulin-producing cells. And of course, it can be a combination of factors. So there's just a lot of complexity here, and it's research that's ongoing. So what happens? Well, if you recall the earlier segment, I talked about diabetes and it being a deranged metabolism. In essence, the glucose that is used to power all the cells in the body accumulates in the blood because there's not enough insulin to help transfer the glucose into the cells. This leads to starvation, and since the body isn't effectively using the sugar that's there, it attempts to make more sugar by breaking down protein and fats. Now, the altered fat metabolism quickly leads to a situation where the fats break down into an acidic ketone or keto acids. And of course, ketones, as some of you may know, include solvents like acetone, and in some cases you can actually smell this on a patient's breath. So the increased blood sugar and the acid lead to a situation where water is pulled out of the tissues into the cells and into the bloodstream to try and dilute the all the acid and the sugar. And this makes people thirsty. And one of the things that characterizes that is the medical term of polydipsia. It's an unusual, unquenchable thirst. Similarly, since they're starving, they're always hungry. And the medical term for that is polyprandia, which means they always want to eat. And again, it's an extreme or unusual hunger. And of course, the third is polyuria. I mean, you're taking all this fluid in, and the kidneys are working overtime not only to get rid of the fluid, but actually to get rid of the glucose. So, what that leads to is something called the 3 Ps. So, for nursing students and medical students and physicians and nurses and other health professionals, the 3 Ps are the polyprandia, polydipsia, and polyuria. So, what happens when it's left untreated? It depends on how much insulin there is, and so the symptoms can be mild to severe. When they're mild, it can actually lead to long-term damage to the kidneys, circulatory system, and heart, because these byproducts do build up, and over time they cause damage to the various organs, and there's changes in the circulatory system due to all this stuff floating around. In a severe case, and where there's really no insulin or no effective insulin, it can lead to a condition called diabetic ketoacidosis, which is life-threatening. That puts you in the hospital, the intensive care perhaps, and it needs to be dealt with. And from that point forward, you need to treat your insulin-dependent diabetes. So, if you or your child exhibits these symptoms of the 3 Ps, please see a health professional. As I said, it's life-threatening. However, if you're treated properly and you're good about your diet and exercise and following your insulin, you can lead a long and healthy life. So that's a real quick overview of type 1 diabetes. I'm Nurse Bob, and we'll talk again soon.